If you've ever felt like a workout that once left you gasping now feels strangely manageable, you're not imagining it. And you're not just getting stronger. You're experiencing a phenomenon known as exercise desensitization, where the same physical effort feels easier over time, not necessarily because your body is working less hard, but because your brain is interpreting the signals differently. This is one of the most fascinating and underappreciated aspects of training. The mind's perception of effort can adapt just like muscles do. This concept is backed by growing evidence in both exercise physiology and neuroscience. In numerous studies, participants exposed to repeated bouts of identical workouts, same speed, same incline, same duration, report a decline in rate of perceived exertion, RP, over time. In simple terms, they feel like the exercise is less demanding, even when their heart rate and energy output remain roughly the same. This is not just a mental trick. It's a product of neuroadaptation and sensory recalibration. The body constantly sends feedback to the brain during exercise. Signals from the muscles, lungs, joints, and cardiovascular system flood in, and the brain processes this data as effort. But like any sensory input, this interpretation is shaped by experience, expectation, and tolerance. The more frequently the brain receives these signals, the less alarming they become. Just as someone who's afraid of public speaking may eventually become desensitized through repeated exposure, someone new to exercise can learn that breathlessness and muscle fatigue are manageable, not dangerous. A key study published in Psychophysiology followed novice exercisers through a 6-week endurance training program. By week 1, most participants rated a moderate treadmill pace as an RPE of 15, labeled hard. By week 6, the same pace averaged an RPE closer to 11, just light to moderate, despite no major improvement in cardiorespiratory markers. Their bodies had adapted only slightly, but their brains had dramatically reduced the subjective intensity of the experience. This adaptation is supported by changes in the anterior cingulate cortex and insula, brain areas involved in interoception, the sense of what's happening inside your body. With repeated training, these regions begin to process exertion more efficiently, reducing the emotional alarm tied to discomfort. You're no longer startled by a racing heart or burning thighs. You interpret them as signals of effort, not crisis. This is exactly how athletes learn to push through discomfort, not because they don't feel it, but because they've learned to regulate their response to it. Another contributing factor is the psychological reappraisal of what exertion means. When people associate sweat and fatigue with improvement, growth, or progress, their perception shifts. Reframing pain as productive has measurable effects on tolerance. In other words, if you believe that struggling through a hard set is making you stronger, it will feel more rewarding and subjectively less difficult. This effect compounds with experience, reinforcing a positive feedback loop. The more you do it, the less it scares you. The less it scares you, the more likely you are to do it again. Interestingly, this isn't limited to elite athletes. Even individuals with chronic fatigue, obesity, or low fitness levels can benefit from this desensitization process. When exercise is introduced in gradual, repeatable doses, the brain learns not only to cope, but to reinterpret the sensations as normal. Over time, what once felt like overwhelming exertion becomes a familiar and tolerable challenge. The takeaway here is powerful. Your perception of how hard something feels is not fixed. It is fluid and trainable. With consistent exposure, the brain learns to turn down the volume on the internal discomfort signals that often derail beginners. This means that motivation doesn't always have to come from external goals like weight loss or performance metrics. It can come from simply knowing that exercise gets easier, not just physically, but mentally. So if the first few workouts feel like a struggle, that's not a sign of failure. It's the beginning of the desensitization process. Stick with it, and your brain will gradually begin to see effort not as a threat, but as a familiar companion. The discomfort doesn't vanish, but it transforms. And when that happens, the path to long-term fitness becomes not just bearable, but deeply rewarding.